RenalGuard, the new frontier of contrast-induced nephropathy prevention. Molinette is a large regional hospital center. Patients suffering from highly complex conditions are referred from surrounding hospitals from the region and from hospitals across Italy. Because our area of expertise is handling patients with complex cardiovascular system issues, we receive a number of referrals for this type of patient. These patients are often older, suffer from cerebral ischemia, chronic renal insufficiency, anemia, or multi-organ dysfunction. These patients come here because they need further evaluation or treatment, be it interventional or surgical. Therefore, everything we do with them tends to be riskier and more likely to compromise the fragile equilibrium of their lives. Renal insufficiency is one of the most important problems we face because it is the primary cause of mortality in patients with coronary disease and in patients with heart disease in general. Now, thanks to the timely and exact balance provided by RenalGuard, we can reduce that risk. We can be more precise, more accurate, foreseeing the patient's problems and thus reducing the procedure risk. And the procedure could be a diagnostic test as simple as angiography. But for these patients, it could be dangerous to the point of compromising his or her lifespan. Fortunately, technology offers better and better tools, and we are grateful for the chance to improve our patients' outcomes. We only hope that this will continue because we know that these needs, already well evident, are bound to increase as the number of our patients increases. Managing age? Many of our very ill patients are very elderly and face multiple clinical challenges. More and more often, we need close to end-stage therapies. And these are opportunities we cannot deny to any patients. RenalGuard is a system which makes it possible to reduce the incidence of contrast-induced nephropathy in patients undergoing an interventional procedure that involves contrast media. RenalGuard provides a constant and controlled hydration, allowing the patient to flush the contrast out of the kidney much faster, reducing the risk of kidney damage. RenalGuard's system keeps the patient euvolemic by monitoring the patient's urine output and infusing an equal volume of saline solution. RenalGuard includes a console and a single-use set. The single-use set is made up of an infusion set with integrated pressure monitoring, an extension set, and a urine collection system. RenalGuard therapy begins an hour before the catheterization procedure begins. The patient is connected to a Foley catheter and an infusion catheter, which are both connected to RenalGuard. Then, a bolus of saline is infused. The bolus amount varies based on the patient's level of hydration. After the bolus is complete, a diuretic bolus is infused to induce diuresis. The required intervention can be performed as soon as the urine rate reaches a level significantly above 300 milliliters per hour. The fluid balance is maintained throughout the procedure. While undergoing RenalGuard therapy, the patient can produce urine at rates over 800 milliliters per hour. After the catheterization is complete, RenalGuard therapy is continued for at least another 4 hours post-procedure. During that time, RenalGuard continues to balance the patient's urine output, maintaining a relatively high urine rate. This allows the patient to flush additional contrast through the kidneys. The trend is that the population at risk for contrast-induced nephropathy will continue to grow. Therefore, I believe it justified to employ any tools that can reduce this complication, which can jeopardize long-term survival. We should use all tools at our disposal, including the administration of sodium bicarbonate, fluimucil, a acetylcysteine, and especially hydration. Hydration is the key factor both according to literature and our institution's guidelines. Still, uncontrolled hydration can be risky as well, especially in patients with left ventricular insufficiency. This explains why a simple machine capable of carefully monitoring both the infused fluid volume and the excreted urine volume is so useful. This device has been evaluated in a trial whose results were recently presented at TCT. The results showed a significant reduction in the rate of contrast-induced nephropathy. We recently started using it with favorable results. Special thanks to the director, Dr. Sebastiano Mara, Dr. Tullio Usmani, and the nursing and technical staff of the 2nd Cardiology Division, Azienda University Hospital, San Giovanni Battista Molinette, Torino. In Italy, RenalGuard is exclusively distributed by Artec SRL.